right, Jacob and Jared join us this morning from Marble City Pharmacy, and good morning to you, gentlemen.
Good morning.
Good morning.
First trip from Tampa.
Man,
y'all didn't last very long.
I've been watching basketball for 4 days, but only one game for Auburn. That's right. That's right.
Diverticulitis. I've heard a lot about that. What is that, though?
That's a fancy word. Diverticulitis. Okay. Sometimes you get in your large intestine, believe it or not, these marble-sized pouches. A lot of times when you get these things, it's not serious. But sometimes those pouches get inflamed. And when they get inflamed, many times they get infected. And when that happens, that causes sometimes very serious abdominal condition. We're going to talk some more about the symptoms here in just a minute. Sometimes when this happens, you don't even know you have it. Sometimes, on the other hand, it can be very serious.
Now, Jacob, I know people who've suffered from this and been in the hospital for not just a day or two either.
No. Depending on the severity of it and the treatment course required based on the severity of it, it can be a go home, no big deal kind of thing, or it can be a you spent 7 or more days laid up in a hospital, with multiple surgeries. There's a lot that can come from it depending on the severity.
So talk about some of the symptoms of this.
Sure. The first and most telling symptom, this sounds great to everybody, pain. It hurts.
Yeah.
It hurts real bad.
In your stomach?
Yeah, pain in the abdominal area, lower abdominal. Most people, for whatever reason, most people lower left. Lower left abdomen, it hurts a lot. Nausea, vomiting, fever. And then this is different than pain. It sounds similar, but it's abdominal tenderness. In other words, this is one of the ways you can tell, is it diverticulitis, is it something else? It's you start touching here, doctor does this, it hurts. Just to touch on it and press in the area, and that kind of differentiates it from some other things. So, but again, pain is the hallmark symptom, and then more often than not, constipation. So you've got something going on. You feel you got something going on. It hurts really bad. Doctor touches on it, it hurts even more. And then the nausea, vomiting, fever, all those often accompanying it too.
Jared, this can be disguised, I guess, because all of us from time to time have a stomach ache or something like that.
That's the thing about it. How do you differentiate between this and other conditions? And the answer is that you can't do that. So this is a situation where we're going to need a doctor. Sometimes we come on this show and talk about things that we can diagnose ourselves, that we can go out to the shelf and find some over-the-counter medication to treat. This is not one of those things. And when you talk about abdominal pain, constipation, I don't know if Jake mentioned diarrhea or not. Some people get the opposite, which would be pretty serious diarrhea when they have diverticulitis. This is not one of those things where you can diagnose yourself. A doctor is going to have to help you with this and get you the right treatment plan.
Who could this affect?
Well, lots of folks. Because by the age of 40, almost all of us have developed the little small marble-sized pouches on our intestine. Just for most of us, it doesn't ever turn into this disease. But by the age of 40, almost all of us have it, which means we're all eligible. So as you age, it gets more likely. You love it. We bring that up on everything, don't we? Age. You love it when we do that.
I noticed that.
Yeah, age is a huge factor. Obesity is a huge factor. So the larger someone is, the more likely they are to have diverticulitis. For reasons I'm not sure I can explain to you, smoking is a big factor. If you smoke, you're much more likely to get diverticulitis, which we're usually talking about lung things with that, but in this case, it's stomach things. Lack of exercise is a big one. Exercise helps the colon stay moving. Keeps things regular, so to speak. Lack of exercise is a big deal for this. And then what we're going to call the bacon cheeseburger diet. That diet high in animal fats, high in regular fats, and low in fiber. So high fat, low fiber diet is huge. So the bacon cheeseburger diet is really bad for diverticulitis.
That's unfortunate.
Yeah.
And then believe it or not, there are some medications that can make someone more likely to develop an actual disease with their diverticulitis. And that is chronic pain medications do that. People have to take them, but they lead to constipation, which leads to pressure, which makes this problem worse. Same thing with steroids, long-term steroids that people have to take, and anti-inflammatory drugs long-term that people have to take. All those can make you more likely to develop diverticulitis.
Let's talk a little bit more about the food aspect of it.
Sure.
What are some other foods other than what Jared mentioned, or Jacob mentioned?
I'm glad that you brought that up. We didn't necessarily have that in what we planned to say. for years and years and years, we've talked about foods that may aggravate diverticulitis. And one of the ways we've explained it is that you got these pouches in your colon and you can eat these particular foods that might get caught in these pouches and cause trouble. You know, we used to talk about popcorn and nuts and you name it, on and on and on, things that could get caught in these pouches and make these episodes worse. In the last few years, though, we've kind of figured out that there's no scientific evidence for that. And so now we don't really talk about those things when we talk about diverticulitis. So if you've heard that, that's fine. There's no reason you can't avoid those if you're having one of these episodes. But it looks like now from the research that we have that those foods don't necessarily cause this problem.
You know, we touched on this earlier, but there are best and worst case scenarios of diverticulitis.
Yeah, you know, best case is, and we mentioned this a little, best case is, you know, it starts, it hurts, it's uncomfortable, we don't want it. We go to the doctor, they figure it out pretty early. You get, you know, a week worth of medications, you go home, you know, you change your diet for, you know, a little while till it calms down and it goes away. Unfortunately, these things are often recurring in people. Somebody that gets diverticulitis episode once or twice is more likely to have multiples of them. But, you know, you get your antibiotics, it goes away, everything's fine. That's best case scenario. Although it makes for a very miserable few days in that point. It's not great case scenario. It's still miserable few days, but you go home, you know, you don't spend any time in the hospital. Worst case, several things can happen. That infected area can get abscessed and infected. It can become so large, or even the scar tissue around it becomes so large, it causes a blockage or sometimes complete blockage of your colon.
That's not good.
No. Or it can rupture. And, well, we kind of know what is inside a colon. Mm-hmm. And when we rupture that and let that out to the rest of us, that's a medical emergency. That's a, hey, we're going in right now and we're cutting you open majorly and we're fixing this and hoping you don't get an infection that kills you.
Yeah.
And so we started from simple, everybody gets it, diverticulitis, so many people get it, to, hey, this can kill you. It's a big jump, right? But we do need to be aware of those things. So worst case scenario is huge. And so when you're having these kind of symptoms, you need to get them dealt with pretty quick.
So how do we prevent it?
Well, it's not necessarily a situation where we can definitely prevent it, but going back to the risk factors that Jacob talked about, first of all, you want to exercise. You know, I didn't say this in the beginning, but one of the reasons that these pouches form in our colon is because they're basically weak spots in the muscle wall of the colon, right? And so when you exercise, you're strengthening all the muscles in your body, right? And so just think about that for probably anything we talk about on this show. Exercise makes you better. It makes you stronger. It helps you prevent just about anything that we talk about here. Eating a diet that's high in fiber. Again, we've talked about a number of stomach conditions that fiber is good for, but fiber helps you have normal bowel movements. It keeps things moving. Things don't get stuck in the colon. Drinking lots of fluids, same theory there. And then, like Jacob said, we don't know why smoking is associated with diverticulitis, but because it is, simply don't smoke. I got a lot of other good reasons not to smoke, but here's another one.
Yeah. Being a pharmacist, is there over-the-counter medication? What kind of treatments do we provide?
Treatments are great. Unfortunately, none of them can you walk in and pick up yourself over the counter. But it makes sense. You have to get it diagnosed by a doctor in the first place. So, you know, it wouldn't really help for there to be over-the-counter medications because you need to be at the doctor to start with for this problem. And so, you know, best case scenario treatment is the doctor's going to write you about a week or so of antibiotics, usually 2 different ones, more often than not, a couple of different antibiotics. You'll take them for a week, and they'll often put you on basically a liquid diet. Let's give it some gut rest is what we call it. Let's not put a bunch of food down there. You know, it's not fun for a week. You get real hungry and lose some weight for a week. But
cause more stomach ache.
But we got to let your bowel heal itself. Yeah. We've got to take the antibiotics for the infection, let your bowel heal itself with liquid diet, and that's the most common answer and works for most people. But we talked about those other bigger problems down the road. The answer to all of those is surgery. Unfortunately, that's a surgeon getting inside you and
see that a lot?
problem. We see that a whole lot.
Wow.
Bowel and gut surgeries are very common. You ask any surgeon and they'll tell you. And sometimes it's not because you had one of these worst case, blowout type scenarios. It's if you get enough of these incidences that are the simple ones, so to speak, simpler than others, it just leaves a lot of scar tissue in there, and eventually that itself is a major issue. and eventually they got to go in and cut it and resection that part of your bowel. And it's a major surgery. It's a big deal. It's a not a risky surgery, so to speak, but anytime you're dealing with a highly non-sterile part of your body, and trying to do surgery, there's possible complications. So it's a big deal. But surgery is definitely one of the treatment options that we have to go to sometimes.
Diverticulitis. That's hard for me to even say.
You got to get a running start.
I knew you'd be excited to talk about this.
Yeah. I don't get out very much,
Yeah, right. This is
So
the best part of your week.
This is not in my notes, but is COVID done?
That's a fantastic question. I guess it depends on how you look at it. I don't think COVID's done as far as it being circulating, right?
Yeah.
I'm sure there'll be a Omicron Deltacron or micro, gamma betacron. I'm not sure. So I think like any other virus, we're probably going to see that from now on. Have we learned better to live with it, maybe? Have we learned what treatment options work? Are there better treatment options available? Yeah, I think there are. There's now increased availability of the brand new oral treatments. And so I think it's weaker than it was, which is fantastic news, But I think in some form, we'll probably be dealing with it maybe forever.
Are y'all still doing the vaccine, or is that kind of quieting down, or what?
Well, yes to both of those. We're still offering them every Tuesday, Thursday. All day, every Tuesday and Thursday, we offer them. The number of people coming in to get them has rapidly decreased.
Yeah. And before we go, I wanted to mention this. Somebody mentioned it to me a few days ago. Is flu season over?
Well, flu season, what is this? March the, what is this?
14th.
Honestly, this is about the end of when most years the flu lasts at latest until April. We haven't had that much flu this year,
Well,
to tell you the
why
truth.
in the world, every time I come in the drugstore, there's people stacked in there everywhere? I guess it's because they like y'all, right?
Listen,
We're an attraction.
there are so many. Yeah, there are so many types of respiratory.
You just love your brother, don't you?
Somebody's got to.
Just because the Bible says I have to.
Yeah, right.
There are all kinds of respiratory infections. It's not like the common cold has gone away or any of these other things have gone away. And so we've had the normal winter illnesses, and we've had them over and over and over in the last few months. We've had very little flu this season. But to answer your question, in a normal year, we're getting to the time of year where you don't see much flu after this.
Oh, that's fantastic. Hey, thank you guys for both coming this morning.
sir.
And very educational segment, diverticulitis. And Jared Jacob from Marble City Pharmacy, our guest. Did y'all eat pancakes a week or so ago?
I did.
Yeah.
I was going on
man.
vacation, or else I would have.
I went through there, picked up ours to go, brought it back to everybody that was working with me that Saturday morning, and we all had pancakes
He's
for you
such a
open the
good
store.
guy. He's such a good guy.
I've learned that if you keep them happy at the store, they're less likely to kill you.
That's Health Monday for this Monday, the 14th day of March. More Daybreak after this.